really aligns with my view of healthcare, which is a multimodal approach to health. And I'll talk a little bit about that today. My talk is Health Reimagined, Innovations Shaping Tomorrow's Healthcare. So at Stanford, I'm part of two centers, Center for Innovation in Global Health, which is health euphemism. Global health is euphemism for healthcare for the underserved around the world. And Biodesign, which is a health technology innovation program, and focuses really health outcomes and equity through innovation, education, translation, and policy. I'm going to tell you three stories today. The first one is a story of health of the world, its history, and its future. When you go back to 2,000 years, maybe even 1,200 years back, pre-industrial revolution, x-axis is resources, y-axis is disease burden. India and China were fairly rich. They contributed about 50% of world's GDP together, and their health outcomes were really, really good. Disease burden was lower because of the affluence, and Europe, and US didn't exist at that time, at least not the way it is now, was on the upper left corner. Well, post-industrial revolution, these regions actually swapped places, and by the time 1800s, 1900s had rolled around, Europe, and now the US, was in the lower right corner. India and China were in upper left corner. That swapping happened partly because of the affluence and also because of the way diseases were evolving, infectious diseases in particular. But where the future really is going to go ultimately, and we are already starting to see this in Europe and Japan and India, where resource availability is starting to become, and you'll see this in Africa, starting to become far more, around a cloud in the center. And the disease burdens, what we were affected by COVID pandemic, that was a shared burden, right? Out of the 8 billion people in the world, there are 5 billion who do not have meaningful access to healthcare. 5. It's a large proportion of our population. And in this day and age, that's really inconceivable. A big part of the reason is that the way healthcare has evolved. Healthcare traditionally used to be very community-driven. Most of the healthcare was provided locally. There were healers in the communities. Doctors knew, the health providers knew the community members. They knew their history, they knew their family history, they knew the history of the individual itself, and that played a major role in the way health was provided to these individuals. Ironically, it moved from the community-centered healthcare delivery to large hospitals over the last century or so. It is sick care because you only interact with the system, with the healthcare system, when you're sick. The reason it moved from the community-centered care to hospital-based care, which is sick care, is because of technology. Irony. It's the big CT scanners, big MRI machines, big interventional cath labs, and so on, which really saved a lot of lives, but it also meant a lot of care actually shifted to these big buildings. And we needed more foot traffic, the HMOs and so on basically required that more and more care was delivered in these hospitals. And this model was exported outside of the Western world. Now India, China, all of these countries actually are following that. The same thing is happening in Africa. So we have actually taken the entire world from community-centered care to this hospital systems-based care, sick care, this double-walled edifice in which everything happens within, but what happens in the communities, what happens at home, what happens at workplace is really, it doesn't matter. If you are quote-unquote well, the system doesn't care for you. It doesn't know that you exist. Interestingly, in the last couple of decades, there are kinds of technologies that are evolving. Those technologies will move us back from the sick care to healthcare to health to the community care-based settings. And I'm using the word health with a very deliberate reason. Healthcare is often a transaction that you do when you are unwell or you're about to be unwell. Health really talks about thinking about an individual or a community and its health status. So preventative health, wellness, all of that becomes part of it. Mental health becomes part of it. Often we don't think about mental health as physical health. We see those as disconnected. There was, in the 70s, there used to be this mind, body, spirit movement. People poo-pooed. And in my own institution at Stanford, we actually really saw that as this new age thing, which really didn't have any real relevance to real clinical medicine. But now we have centers at Stanford which talk about this, right? And in that journey of moving from sick care around the world to community-based care to the health of the overall community, innovations from Global South are going to play an important role. Of course, Silicon Valley is a hub for technology innovation. A lot of health technology comes out of here, a lot of AI, very interesting stuff that's happening at Google, other places. My own students are working on really, really interesting things. But I would argue that a lot of work we are doing here has not as much of a relevance to Global South, which means it doesn't have as much of relevance to the world. And especially if you believe that last image that I had in those 3 2x2s, where the resource is going to be common and the disease burden is going to be common, we really need to be looking at solutions and innovations that are coming from outside of here. So the India story is what I want to talk about. Last 17 years, we've been training health technology innovators in India in the Biodesign framework, which is a design thinking-based approach to healthcare innovation, identify unmet needs, invent a solution, implement it. Common sense. Common sense is fairly uncommon in health technology innovation. The point that we're making is very simple. Understand the problem before you solve it. And that's what we've been teaching for the last 17 years. We started with 4 fellows in a country of 1.2 billion people every year. We would train them here at Stanford, we'd send them back. These 32 fellows that we trained in 8 years became the gurus of health technology innovation in that country. India decided this is actually what they want to invest in. They have created lots of innovation programs, Biodesign programs. And now India today has 10,000 innovators working on health technology. And it's the 3rd or 4th largest innovation ecosystem, depending on how you look at it, in the world. Over the following 8 years, we trained fellows, lots of fellows came out, lots of innovators came out, and we realized that these innovations are not going to get to the patients. So we started working with them to bring those technologies to patients and Founders Forum. We realized that we needed to work on policy. Policy is a big lever. So we started working with the governments, different governments within India, the central government and state government, and that's where we are today. I'll give you some examples of the kinds of innovations that are coming out of Global South. These innovations actually enable the kind of shift we are talking about, from going from healthcare system, big institution-based care, to community-based care. It's a newborn hearing screening device. This actually brings hearing screening to under a tree. You can actually do this, not really under a tree, but into rural communities where there's a very noisy environment, the audiologists don't exist. So you're really getting local health workers empowered and enabled in India, which doesn't exist today. A lot of babies who are born with hearing loss actually end up having a very different trajectory from babies who are not born with hearing loss, and that actually impacts those communities, those families, the Indian society at large. So this is a hardware and software combination solution. There's an AI component to this, and it's really been implemented across many states in India. This is the first innovation of its kind in neonatal resuscitation in the last 50 years. It's a foot pedal operated neonatal resuscitator. What this does is allows one healthcare worker to cradle the baby while delivering the resuscitation and being able to manipulate the baby with a mask. And the data shows that actually nurses that are not as well trained in remote settings can do just as well as pediatricians with our current bag and mask system, shifting the care back to the communities. This is a really remarkable solution, which is not just an innovation in technology, fundus camera, and AI-based analysis of images from fundus camera. It's also a healthcare paradigm innovation. These fundus cameras were set up across a given state and different rural communities. Healthcare workers actually use these to screen these patients. The image was uploaded to cloud, and AI solutions actually assess the patients. If the patients had certain eye diseases, they were moved on to next level of care. Apollo was partner of this startup. State government was funding it, so it was a public-private partnership, and it has already impacted 17 million plus patients across India and other parts of the world. TriCog has CT-based imaging analysis platform that identifies patients who might be suffering from heart attack, catch them within the golden hour, move them to an intervention very, very quickly. This has already touched more than 20 million patients and saved thousands of lives in India. And it does that at a fraction of a cost of what the costs are in tier 1 settings in India, as well as places like Stanford. So those were the examples of the kinds of technologies that basically are shifting the care using these really high-end technologies. There's AI in there. The algorithms that are being built are leading edge algorithms. This data there's a lot of data that they're generating, and that data is really proving very useful to identify the disease in settings where otherwise you would not be able to, because you don't have trained personnel, you don't have the appropriate technology. So they have hardware, software, and the care pathway innovation, all of that coming together to really shift that care from the healthcare system-based or institution-based care to homes and communities. And that ultimately will bring us to hopefully a future where it's a distributed healthcare, distributed health. We would be in a place in maybe 50 years where our resources are going to be shared, similar level of resources in a cloud of countries, whether it's Africa, it's Asia, whether it's Europe, it's Latin America, and the status of health across the world will be in a similar place. There is indication this is already happening, and you can see the technological innovation that's coming out of Global South will probably take us there. Thank you.